We distinguish between rhinosinusitis and pharyngitis, and we looked at the likely causative pathogens. We also looked at empiric therapy of bacterial rhinosinusitis. Now, given a patient with acute streptococcal pharyngitis, recommend an appropriate therapeutic regimen. These are the recommendations from the 2012 IDSA guidelines specifically for Group A streptococcal pharyngitis. So Group A streptococcus is Streptococcus pyogenes. So GAS is short for Group A streptococcal. So they do recommend that patients for Group A strep pharyngitis to be treated with antibiotics, and the duration is typically for 10 days. And they're recommending that based on narrow spectrum of activity in frequency of adverse reactions and affordability, to either penicillin or amoxicillin as the drug of choice in patients who do not have penicillin allergy to it. If someone does have penicillin allergy but it's not anaphylactic reaction, you can use a different class of beta-lactam, so first-generation cephalosporin. So first-generation cephalosporin are also narrow, they're well tolerated, and they are affordable. So something like cephalexin would be useful. Or if someone had anaphylactic reaction, then you got to use a non-beta-lactam. So either clindamycin or azithromycin would be recommended. So either macrolide or clindamycin as an alternative if someone has anaphylaxis to beta-lactam. There are also adjunctive therapies that you can do. So mostly, since these patients typically have fever, you can give them something for fever that would make the patient comfortable, so acetaminophen or an NSAID. And it's important to note that they do not recommend corticosteroids in patients with Group A strep pharyngitis.